we will discuss how doctors approach the evaluation and diagnosis of high calcium levels, also known as hypercalcemia.
Calcium is an essential mineral in your body, but having too much can cause symptoms and indicate underlying issues. The process starts with confirming whether the calcium level is truly elevated and understanding what might be causing it.
First, doctors verify the diagnosis by repeating the calcium test.
Sometimes initial results can be misleading. They also check previous calcium levels if they are available. If someone has had slightly high calcium for a long time without symptoms, conditions like primary hyperparathyroidism, a common cause of mild persistent hypercalcemia, or a rare inherited condition called familial hypocalciuric hypercalcemia might be suspected. The level of calcium in your blood helps narrow down the possible causes. For example, mild elevations, calcium levels below 11 milligrams per deciliter or 2.75 millimoles per liter, are often linked to primary hyperparathyroidism. However, if calcium levels are very high, above 13 milligrams per deciliter or 3.25 millimoles per liter, this is more commonly due to serious conditions like certain cancers. Calcium in the blood exists in two forms. One part is free or ionized, which is biologically active, and the rest is bound to proteins like albumin. Total calcium, the number you see in standard blood tests, includes both forms. Because albumin levels can affect total calcium readings, doctors sometimes correct the calcium value based on albumin levels or measure ionized calcium directly if there's any doubt about the results.
For instance, if someone has low albumin due to malnutrition or chronic illness, their total calcium might appear normal or low, even if their ionized calcium is high.
On the other hand, if albumin is high, like during dehydration, the total calcium might seem elevated even when ionized calcium is normal, a situation called pseudo-hypercalcemia. Rarely, conditions like multiple myeloma can cause unusual protein binding that falsely increases total calcium levels while ionized calcium stays normal. When adjusting calcium for albumin, formulas help estimate the correct value. While widely used, these formulas aren't perfect, and labs may use different methods. Generally, it's assumed that calcium drops by 0.8 milligrams per deciliter, 0.2 millimoles per liter, for every 1 gram per deciliter decrease in albumin, but this adjustment varies.
Through careful testing and interpretation, doctors ensure they have an accurate understanding of your calcium levels to guide the next steps in identifying the cause and planning treatment.